The innovations in cataract surgery have been ongoing for the entire 30 years that I've been operating. However, the innovations or changes in cataract surgery that I'm most excited about at this point in my career are the changes in the lens options that we can offer patients. When I was first doing cataract surgery, for probably the first 15 years of my career, we offered lens choices with just one lens choice, which was what we call monovision or monofocal lens, which included vision at one distance, either far distance or near. And since these changes in options have occurred, we've been able to offer patients great choices in lenses. For instance, if somebody has what's called astigmatism, which is basically a measure of outer roundness of the eye, we can offer them a lens that eliminates or significantly reduces that astigmatism to give them good uncorrected distance vision. Along those same lines, we now can offer patients who have a desire to go without glasses for much of their day, and those lenses are what we call multifocal lenses, which allow theoretically for distance and near visions without correction. And I would say a vast majority of my patients are very pleased with the outcome when we perform surgery and implant the multifocal lenses, and that they perform most of their daily functions, including reading, without the use of glasses, probably 90% of their, 95% of their day. The most recent introduction in our practice has been the use of what are called light adjustable lenses. And these lenses I've been hearing about for years and years, and finally the technology has come to the market. These lenses we can make changes in after we've implanted the lenses based upon the patient's desires. So if I implant a lens and the patient says to me, "Oh, I'd like to see a little bit better for distance, Dr. Hulburd," then we can make appropriate adjustments. And with a special light and microscope, we can make changes in that lens to allow them to see better at distance. After we put the second lens in, we then ask the patient, "Are you pleased with what you're seeing? Do you like your distance vision? Do you like your near vision?" And if they say, "Can we do a little bit of improving on my near vision now, Dr. Hulburd?" Again, we can make any significant changes they want postoperatively by performing light treatments that average about 2 minutes in length. And we can treat up to 2 or 3 times after the surgery to make fine adjustments in how well they see for distance or near. And then we have some what are called lock-in treatments. So these treatments have really kind of revolutionized cataract surgery. The stress of choosing the right lens power for cataract surgery is lessened greatly with these lenses because we can make adjustments in them afterwards. And most importantly, these changes that we make in the lens, these adjustments we make in the lens, are directed solely towards the patient's desired outcome. So the patient gets to participate very actively in how well they see and what they see after surgery.